Welcome to this explainer. I'm thrilled you're here. Today, I'll be acting as your expert medical billing educator as we dive into part 4 of our training, which focuses entirely on pricing networks, TPAs, and self-insured employer groups. If you've ever found yourself wondering how the money actually flows behind the scenes of a medical claim, well, you are definitely in the right place.
Okay, here's our roadmap for today. We'll start with the intermediary role of pricing networks, look at multi-network cards and pricing selection, then move into third-party administrators. After that, we'll break down the economics of self-insurance, look at TPA contract fees, and finally wrap up with a summary and our next steps. Let's jump right into Section 1, the intermediary role of pricing networks, navigating the middlemen. Now, a key concept you need to keep in mind is that the commercial carrier cutting the check at the end of the day isn't always the one deciding the actual value of the claim. That job usually falls to the payer network. Think of a payer network as a middleman, an intermediary agent. They operate on behalf of those commercial payers, and their specific job is to negotiate and determine the final cost of a healthcare claim. So let's look at the mechanics of how this actually plays out. When both you, the provider, and the commercial carrier are participating in the exact same network, a specific workflow is triggered. First, the network steps in, receives the claim, and prices it based on their established, contracted rates. Then the commercial carrier simply pays the provider according to that network's pricing. They've essentially just outsourced that pricing decision entirely to the network. Moving on to Section 2, multi-network cards and pricing selection, the financial traps. Here is where things can get a little dangerous for your revenue. Insurance carriers often don't just belong to one single network, they belong to multiple pricing networks. And their strategy is pretty straightforward. These carriers will dynamically route your incoming claim through whichever network gives them the absolute highest financial advantage. It's a really savvy payer pricing strategy to maximize their own savings, but as you can probably guess, it can result in significantly lower reimbursement for the provider. This illustrates the danger perfectly. If you don't catch this multi-network strategy right there at the front desk, you are setting yourself up for unanticipated write-offs. And as a reminder, a write-off is that portion of the claim that neither the payer nor the patient is legally responsible for paying. It just gets canceled out entirely due to those contractual obligations. Because of this trap, we have a very strict billing verification rule. You absolutely must physically or digitally inspect the patient's insurance card. And you're looking specifically for multiple network symbols. Identifying the active pricing network right up front is literally the only way to accurately predict your reimbursement and protect your practice's bottom line. Right, let's head into Section 3, third-party administrators, or TPAs, the specialized intermediaries. A third-party administrator, which we call a TPA, is an intermediary entity that functions just a little bit differently. They either operate their very own proprietary network or they access other external networks. Their main goal here is to adjudicate and price claims so they can keep the expenses of medical treatment strictly under control. You'll find that TPAs are widely utilized by two main groups in the healthcare space. First up, labor unions. They frequently use TPAs to provide highly tailored, cost-effective healthcare coverage for their union members. Second, you have small businesses and commercial employers who want to self-insure because they are looking for extremely tight control over their healthcare spending. Which brings us to Section 4, the economics of self-insurance, the cost and the gamble. Let's put some numbers to this and look at the baseline comparison. When a small firm uses a standard traditional commercial carrier, it costs them roughly $450 per employee every single month. That rate is based on the group's age and health history, but the point is it's a fixed, predictable premium. Now flip that to self-insuring through a TPA. Here, the business pays a participation fee to join the network, but after that, they only pay for the exact actual medical claims incurred by their employees. So what this means is that under a self-insured TPA model, the company is paying healthcare providers directly out of their own company bank account, using the TPA's network pricing. If their employees stay relatively healthy, that small business has the potential to save a massive amount of money compared to just handing over $450 a month per person to a traditional carrier. But of course, this incredible cost-saving strategy begs a critical question for the employer. Honestly, it's the biggest gamble in self-insurance. What happens when disaster strikes? The catastrophic risk here is totally severe. Just imagine a sudden disaster or a major illness outbreak that sends several workers to the hospital at the exact same time. Because the employer is on the hook for paying those actual incurred claims directly,
A scenario like this can completely financially destabilize or even ruin a self-insured company if they don't have the massive financial reserves needed to cover a sudden, massive spike in hospital bills. Let's look at Section 5, TPA contract fees, provider and payer obligations. Despite all this unique, self-funded stuff going on behind the scenes, from your perspective, sitting at the medical billing desk, TPAs are generally treated exactly like standard network contracts. You bill them and you interact with them using your standard network protocols. However, you absolutely must be acutely aware of the fee structures written into these specific agreements. As part of a TPA network agreement, providers might actually be liable to pay an administrative fee on the claims that have been adjudicated. Meanwhile, on the flip side of the equation, the insurer or the employer is required to pay a participation charge just for the privilege of joining that TPA network.
All right, we made it to Section 6, Summary and Next Steps, Mastering Intermediaries.
So let's recap. We've seen how intermediary pricing networks step in to establish claim costs on behalf of commercial carriers. We highlighted the absolute necessity of verifying multi-network cards upfront at the desk to protect your practice against surprise write-offs. And we've uncovered how TPAs actually manage the high-stakes, high-risk economics of self-funded employers and labor unions. Getting a solid grasp on the distinction between an insurer and a TPA is so crucial because in Part 5, we are going to dive into the messy stuff. We're going to tackle how to resolve complex claim adjudication disputes, like what to do when a TPA wrongly prices a claim, or when a traditional payer absolutely refuses to settle based on that pricing agreement. I'll leave you with this provocative thought. If an employer is self-funding, but the TPA is the one pricing the claim, who actually holds the ultimate financial leverage when a serious dispute arises? We're going to uncover that answer next time. Keep your billing sharp and like, share, subscribe to Decode Healthcare with Harshal.